president had created a ministry called the Ministry of Livestock. And so in that ministry, everybody is important. And, when it comes to health, it's a teamwork, because we have the veterinary professionals, veterinary paraprofessionals, the technicians, everybody, so all hands must be on deck to ensure that we actually get it right. And that's why I think it cannot come at a better time than now. I want to quickly say that the president of the Veterinary Council of Nigeria says one thing every time he has opportunity to speak. He said it is not about competition, but about collaboration. We all need to come together to ensure that actually we move the animal health to where it ought to be. So I think it's important we all come together. Thank you very much.
All right. Any other person want to add to that? I mean, the importance of teamwork in terms of this.
So good afternoon.
Yes, ma'am.
Dr. Malcolm speaking. Yeah, the Veterinary Day, the World Veterinary Day is important. Celebrating veterinarians is important. It's a day set aside, and this year happens to be the 25th year that this will be celebrated worldwide. Since 2000, the year 2000. The World Veterinary Day has been celebrated. It's a day set aside to celebrate the work that veterinarians do behind the scenes. Veterinarians work daily. If you are asked who is a veterinarian, the first thing that comes to your mind is the person who takes care of your animals.
Yeah.
But the veterinarian works not just to take care of your animals. The veterinarian takes care of human health, takes care of the environment. We've always understood the need for teamwork, even long before the rest of the world and health services realized that you can't do it alone. So we've always collaborated. It's a teamwork all the way. And now the whole world is realizing that that's the best way to go.
Indeed.
And that is why there is something they call One Health there, and so many. It's all about teamwork. The veterinarian works with, and we work together with the zookeeper, with the rangers, with the animal health technicians. It's a whole lot. Our patients, our primary patients, don't talk. So to understand them better, it has to be done collectively, collaboratively. Thank you.
Indeed. Thank you so much for that. Now, let's talk about the role of the veterinarian, in terms of public health, food safety, and zoonotic diseases. Dr. China earlier on talked about, the fact that many people don't even put that into consideration. So what's the role of the veterinarian in all of this? Who'd pick on that?
Okay. Thank you very much. I will say this. The role of the veterinarian in food safety and zoonotic diseases and even public health cannot be overemphasized and should not be downplayed. Because let us start with zoonotic diseases. These are diseases that can be transferred from animals or from animals to human beings. Diseases that animals and human beings share. One of such diseases is tuberculosis. Even the rabies that we are so much involved in, they control every year. They are diseases that a human being can contact by either a bite or consuming infected products from an animal that has that disease. And what the vet does is to ensure that those diseases does not exist in those animals. So that when you consume them in the comfort of your home, you will not be infected. So from our work in the abattoir, from our work on the clinic floor, even the sheer preventive medicine principles that we put in place, vaccinating those animals every year, keeps those diseases away from affecting human beings. And that, even though you are the comfort of your home, like she said, what we are doing behind the scenes, nobody sees that. But we are there in the abattoirs. What you do, you go to the market to buy your meat. But before the meat gets to the market, it has been inspected, it has been screened. Animals that are infected are not allowed to be slaughtered, especially if we know that they have such diseases that can affect you. And besides that, in fact, the same point goes for food safety. I'm explaining both food safety and zoonotic disease, and consequently the public health. All this work together to protect the health of the public, to ensure that there's no outbreak in our communities of such diseases. Thank you very much.
All right, so I'm saying something like a unified animal health team. What's that about? Can you help us understand what's a unified animal health team?
As a medic, I'm a medical epidemiologist, so I'm not a veterinarian, but I appreciate what veterinarians do.
Okay.
And we've known that for us to keep the world safe, we need working in silos would not help anyone, because the human, the animals, and the environment, they coexist. And that's why we now talk about One Health. We try to see how we can collaborate in terms of disease surveillance, in terms of outbreak response, trying to detect diseases. We need to work together with the veterinarians, because it's now known that 70% of the emerging and re-emerging diseases are zoonotic in origin. And when we say zoonotic, that means that there's the animal-human interface in the cycle, in the life cycle of the organisms that cause these diseases. So it's very, very important working with veterinarians. I've been opportuned to learn with veterinarians, to work with veterinarians, and they are such a lovely people to work with.
How would you say, how effective has your collaboration and synergy with the veterinarians been in terms of achieving results over the years? What would you say about that?
Yes, we are not there yet. We are not on the scale of 1 to 10. I will not say we're at 10, but I know that we are above 5. Like in FCT where I work, we've worked closely in the human influenza virus, in avian influenza too, which has a possibility of coming to humans. We've worked together in the rabies outbreak, Lassa fever, name it. If we could recall, at a point it looked as if it is just strictly human, but even the COVID pandemic is zoonotic in origin. So there's always a need for that collaboration for us in the community at the level of surveillance to pick up what is happening, to pick up the signals that we need to follow. Because sometimes the link comes from the animals, sometimes it comes from the humans, and you need to track to the animals. So sometimes, for example, a dog bite, maybe in the clinic, human clinic, and somebody will present that a dog has bitten me. So you need your colleagues, the veterinarians, to go and assess that dog and give you a feedback for you to know whether this dog is likely going to be a rabid dog. And sometimes it is from their own end that they pick up signals and inform us that a dog bite has happened somewhere. You need to link up to ensure that this person takes the necessary post-exposure prophylaxis. So the example is limited.
Wow, that's very, because I remember Dr. Sharifat were talking about rabies some days back, and all of these things were actually exposed, and it's quite important to see. One thing you said that really got me thinking is like over 70% of the diseases is from animals. I think many people don't even think about that. But I think it's driving home a point. You wanted to say something, ma'am?
I wanted to add to that.
Yes.
The 70% is of all emerging and re-emerging diseases. But the existing infectious diseases of man today, 65% more are from the animals.
That's quite a number too.
Yes. And that's a fact. And that's why they must work together. He mentioned examples of Lassa fever and other things right now. In the past...
Ma'am, please, can you use that mic? Because I think it's not so... Yeah, maybe you can just compliment. Thank you.
In the past 8 to 10 years,
yes,
the collaboration, the cooperation, the communication between the animal health, human health, and the environment sector has been strengthened, and it continues to be strengthened. There is a One Health platform, and there are a lot of activities being done together now between the three sectors to ensure a good national health security for Nigeria and the global health security as well. So yes, it's getting better with the realization that a lot is going on in the animal sector that need to be stopped right there. And if allowed to spill over, if it stopped there, humans won't even know that anything is going on. Exactly. But then when there is a spillover, then they get on board. And so when we are working together, they are alert. They are ready to jump in when the need arises.
Wow. Thank you so much. Now, let's further talk or probe this unified health team. Importance of the One Health approach, linking animal, human, and environmental health. Sir, do you want to talk about that?
Okay, it's very important. Like we've been talking, looking at collaboration. One area I know we are still trying to do a lot, and we need to actually look at it very well, is the area of AMR, antimicrobial resistance. I'm saying that because we spend so much money, trying to take care of these things in humans, when it ought to have been nipped in the bud by from the animals, because many of these things come to us from what we consume. Like what he said, we are the ones that are gatekeepers, ensuring that these things don't even cross the border to humans, because it's more expensive. Prevention, we know, is better than cure. So when we look at it very critically, coming together to unified and actually working together, will achieve a better result, because when we are given the right of place to do what we're supposed to do, it will help strengthen preventing it from getting across the board. So, but as it is now, let me be very, very honest with us. We play lip service to some of these things, and we need to actually do well, to ensure that this is being done. Because if you are not empowered to do what you're supposed to do, you just know, but you can't implement. So, for instance, this AMR thing, if you go around the place, you notice that people are just meddling with the drugs anyhow. They are not, nobody is actually doing anything to ensure that this is actually nipped at the bud. And, it's the porosity that we have in the system can only be, taken care of when we have this collaboration, when we have this unified system. So I think we are getting there, but we are not yet there in making sure everybody comes on board to ensure that these things are nipped at the bud. Thank you.
Interesting.
I believe we also need stronger legislations that have strong sanctions so that people are forced to do the right thing. In countries where these things apply, that's what happens. We can't be lawless as a country and expect to make progress. So we need the enabling laws and the proper sanctions so that if you say do not use more than this, you must allow this animal after treatment with an antibiotic to rest for 2 weeks or more before presenting it for slaughter, that people abide by it. But what happens is that you see somebody just gives an antibiotic to his animal, it doesn't seem to be improving in health, and they send it to the market the next day. And that gets into the food chain, affecting humans, leading to antimicrobial resistance in humans.
Somebody gave this story on Facebook yesterday. I was reading, and it shocked me, even though I was not too shocked. The fact that he went to buy a chicken in a certain poultry, and then to the side there were some people who were negotiating, like it seems some dead animals. Like he was like, "What's that? What's happening?" He said, "Is this roadside suya sellers, people who sell chicken, that they actually help his business because they buy off the dead and sick chickens and all of that." So I feel you're very correct in terms of this legislation. There's a whole lot of gaps that exist, and if that can be taken care of, I guess we would not have to come face to face with some of the issues as it relates to some of those zoonotic, but like I mentioned, gaps. I would want you to please talk some more about, the gaps that exist in interprofessional communications. I mean, who would want to take that, Dr. China?
Yes, I told a story last year, and I like repeating it whenever it comes to vet and collaboration. I was running a program, and I know what told a story how 6-year-old girl died because of lack of collaboration. Why? She was beaten by a dog. But because the human counterpart wasn't there, when she started, exhibiting these signs, and she didn't even tell her mother, because she thought, it's our usual dog. It's the usual play. Because the human, health worker in that community was not readily available. The vet was not readily available. That girl just died like that because there was no collaboration. So I've always advocated for this synergy, collaboration, so that we can stop this. The earlier we get it right, the better for all of us. Thank you.
Okay. Any more? Any person who wants to add to that in terms of the gaps that exist?
She gave an example with rabies. And when you call rabies, my ears just stand like that of a dog. Because that is the NGO that I am directing, Kick Out Rabies Initiative. It's really a shame when any human being has to die from rabies. 100% preventable disease, vaccine preventable. So we need to work together. I thank God for FCT. We have a rapid response team on rabies, and I'm sure the government is also trying to establish this in all the states, so that once there is a dog bite, for example, and rabies is just one out of so many. If there is a dog bite or any such signal, that it can easily be, mobilized, and as a team, they go out and investigate together. What's the cause of this bite? What is the necessary line of action to take? And together we'll always have better outcomes. Thank you.
Okay. Interesting. All right. So let's also talk about, resource constraints and also capacity issues. What would you say are some of those constraints that you face in the, on the job and capacity to serve? Dr. Badipe, do you want to talk about that?
Okay. If it has to do with limitations, when it has to do with human resource, capital,
more conversation
is actually a very, very huge problem as we speak.
All right, so I might have to stop you because we have a commercial. We'll continue after this.
And New Central has delivered.
Now you've got it. Yes, New Central is live on GoTV Channel 23. Get the latest news and headlines from Nigeria and across the world. With GoTV, News Central gives you major stories and breaking news on politics, business, sports, and entertainment. You asked for it. And now, you've got it. News Central on GoTV Channel 23.
We've told you about the Cape by Hall 7. The stunning house types, the impressive amenities, the expansive green spaces, and the intentional design behind it all. Now, it's time to see it for yourself. You're invited to the Cape Site Experience Tour, a full-day event where you'll have your personal tour guide to show you around the rapid progress and lifestyle-focused estate we're curating. Date, Saturday, 26th of April, 2025. Time, 10 a.m. till dusk. Venue, The Cape by Hall 7. For directions or inquiries, call 0704 800 1075 or 0704 800 1076 or visit us at number 8C.
Connection established.
All right, welcome back. Our conversation continues Saturday in the month of April. This year, it will be marked on the 26th. And I have some well-able veterinary doctors in the house with me. We've been discussing issues around veterinary medicine practice and all that it involves. Well, not all, but the issues, we're trying to bring them to the fore. I have Dr. Fadipe Oladotun, Dr. Jacobs, Dr. Umar Okoli, Dr. Chinemeka. I also have Dr. Lydia and Dr. Lukman Lawal and Dr. Sharifa. They're all here. Dr. Fadipe, we were on talking about the constraints and other issues, right? So you were answering that.
Yes, I was very anxious to actually talk about that because as we speak, there's actually a lot of gaps when it comes to human capacity. Let's look at the Nigerian scenario, for instance. We're advocating that for every local government, you should have at least 5 veterinary doctors. But as I speak today now, we have some states that don't even have up to 5 veterinary doctors in their employment.
Wow.
So how do you handle this situation? And the grassroots is where a lot of things are taking place that they're not even reported. And we all have our parents, our friends, and loved ones all over the place. So as we speak now, we have a lot of places that don't have manpower to even do anything, and they're helpless. So I think it's calling on the government to look at this thing very critically to ensure that we have enough and adequate and if you look at the way the human medics are also leaving the country now, it's actually very alarming. You see them actually trying I have an uncle who is a medical doctor, and he has 2 of his sons trained as a medical doctor, and I was very happy that they were going to take over from him. One is in UK, one is in Australia as we speak. So everybody is going because of the way things are being done in our country. And I think we need to actually look at it to ensure that we have enough manpower to deal with these things. It's worrisome. Thank you very much.
All right. So, we talked about the unified action, and specifically, I think we focused on rabies. Can we also talk about, this issue of avian influenza surveillance through joint veterinary and public health teams? How much have you achieved with that?
So thank you. From the human medicine side, we've achieved a lot. As an example, recently, about a month in February, we had a simulation exercise in public health preparedness. Simulation exercise means where you assume something is happening, it's not happening, and you try to see how you're going to respond. So the last one that was done nationally, in which FCT also participated, was around human influenza virus, creating a scenario, assuming we have an epidemic of human influenza virus, avian influenza virus that is spreading into the humans. How are we going to work together? So such on-the-job learning, experience sharing opportunities gives us an opportunity to be able to see where our strengths are, where our weaknesses are, so that we can collectively respond together. In the country, currently, there have been pockets of avian influenza pandemics that have been reported. And each time, sometimes the alert comes from the human side, sometimes it comes from the animal side. But whichever side comes, the team needs to come together to assess, because even if you're assessing the birds, if you are assessing the animals to know whether